So we have different kinds of professionals, and I'll just put those all three up there. You should be able to distinguish between those three on your those three categories on your test. A lot of people I find don't know what their therapist is. For example, they say, "Oh, I got a therapist," or "I got a counselor," and you say, "Okay, what's their degree?" And they're like, "Oh, I don't know. They're just my therapist, right? What's their license? What? I don't know." Or they'll say to me, they're like, "Well, you're my psychiatrist, right?" And I'll say, "Well, no, actually, I'm not your psychiatrist. I am a licensed clinical psychologist." Now, from a layperson's point of view, that may not really matter. What really matters is the person is trained and that they are licensed and credentialed. For protecting the public, we should have minimal standards of competence in any healthcare profession, including mental health care, and we do. But we have people across the gamut trying to help people out. Paraprofessionals have no formalized training. They might have a bachelor's degree. For example, I had a bachelor's degree and I worked at a runaway youth shelter, runaway and homeless youth in Charlotte. And I helped kids, but I was not a licensed clinical anything. I wasn't a master's level therapist, and I certainly wasn't a doctoral level therapist, and I wasn't allowed to call myself a counselor. They called us originally part-time relief counselors, but then they changed that designation because technically we weren't. We were people who cared, and we were people trying to help people, but we did not have advanced training and could not call ourselves counselors, much less psychologists. You can't do that. So paraprofessionals have no formal training in mental health care, right? They may have an interest in mental health care. They may have some initial education, but no formal training. And that's important because when you move to different levels of responsibility in the mental health care system, it's not that somebody with a bachelor's degree or even without any education at all couldn't be helpful to another human being. Clearly they can be. But when you are engaging services, paying for services to get a return on that investment where you should expect improvement in your life, you need to make sure that people have the requisite qualifications to deliver those services. So paraprofessionals are part of the mental health care paradigm, but they don't have formal training in mental health care at advanced levels. Psychiatrists are medical doctors. They are MDs, or theoretically DOs at this point. So a psychiatrist has a medical degree, but you know there's all kinds of physicians, right? There's family medicine, there's pediatricians, there's obstetricians, there's surgeons, internists, on and on and on, in all kinds of specialty areas. Well, they're all medical doctors, but what they do is after they get their medical degree, they then specialize by getting additional training in some sub-area of medicine. So for the psychiatrist, you have a medical doctor who now is specialized in the treatment of mental health issues. They are very likely to perform, they are very likely to prescribe medication, but very unlikely to perform traditional talk therapy, which is kind of ironic because it was medical doctors who developed therapy to begin with, right? Early on, you saw most of the therapists were medical doctors. It was only after World War II, and we had this huge influx of veterans who had things that they called shell shock back then, which we now recognize to be PTSD, and they were overwhelmed, so they reluctantly allowed doctoral level psychologists to also perform talk therapy. But then we talked about the onset of Thorazine and the pharmacological revolution that came along with that, and only medical doctors can prescribe medications. I'm a psychologist, a doctoral level psychologist, but in the state of Tennessee, I cannot prescribe medications, right? I can't take people off medications or put them on medications. Only in rare exceptions, there are a couple of states that allow for psychologists who get extensive additional training beyond their doctorate to prescribe a very specific subset of medications for treating mental health issues. So there's a difference. You look at psychiatrists, they're medical doctors, because what they deal with is not usually your run-of-the-mill depression, which might very well be treated by a family physician, for example. They usually deal with really complex and severe mental health issues where multiple medications may be indicated, and that takes expertise to manage. Any physician can prescribe for depression, like an SSRI or something like that, or for anxiety, an anxiolytic agent or something like that. But the more complicated the case is, the less comfortable they will be prescribing medications, and they might refer somebody with really complex or severe issues to a psychiatrist for complex medication management.
A paraprofessional, would that be like a mental health tech in an inpatient?
Yeah, it could be a mental health tech. So, for example, I had a bachelor's degree and I was working at the youth shelter. So I was helping people out. I was getting paid to help people out, but I couldn't call myself certain things because it denoted that I did not have advanced training. Very similar to that, I was a mental health tech at a place in Charlotte, which was a partial hospitalization program. So I worked 40 hours a week helping people out who had severe mental illnesses, but I couldn't conduct therapy in the group, for example. But the group therapists were all at least master's level trained and licensed professionals, and that's the difference. So yes, good clarification. Further, there's other types of mental health workers besides psychiatrists and psychologists. There are, for example, licensed professional counselors. You can get a degree here at ETSU to become a licensed professional counselor with a master's degree and go and do therapy. You then have to become licensed, right, in addition to your training, which has additional requirements, and you have to be insured, as do all of the professionals in healthcare provision. There's also licensed clinical social workers, for example. Then there are subspecialties inside of medicine where you might have somebody who's a physician's assistant, or you might have somebody that is a nurse practitioner or a psychiatric nurse, people who have medical training of different types that then specialize in the care of mental health issues. So those are all possibilities. If you're going to seek professional help, there's some guidelines. Identify the professional's credentials. You look at the research, and master's level practitioners and doctoral level practitioners have roughly equal outcomes. So they both help a lot. And you might go, well, why would I go on to a doctorate if I can be equally as effective? Well, a doctorate comes with additional kinds of training. For example, I'm a research scientist in addition to being a therapist. That takes additional training. So there's different levels of training for different outcome purposes, but the provision of therapy by a competent licensed professional seems to be roughly equivalent across different kinds of training. If you think about it, somebody who gets their master's degree in, say, 2 or 3 years, then goes and practice for the next 2 or 3 years that I'm in school. I'm getting additional training, but they're getting full-time practice in mental health care, supervised by other professionals. So they're getting practical experience while I'm getting additional training. And at the outcome, roughly equivalent. But you need to know that the people are qualified. So you should seek to know what their qualifications are. If they're an LPC, if they're an LCSW, if they're a PhD, if they're an EdD, if they're an MD, those things matter because you want to make sure you're getting your health care from somebody who's qualified to deliver it. Give therapy time to work and sincere effort. Some people get dragged kicking and screaming to therapy. It ain't going to work. You know, if you don't want to be there, and you don't think there's anything to be gained by being there, it doesn't matter how much time you sit there listening to somebody. You're not going to do the required work on yourself to see improvement. You have to give it time and you have to give it effort. And if you do give it time and sincere effort, you should see change. And if you don't see change, there's something going on and you need to check into that. You might want to see about switching providers if you're not getting outcomes that are beneficial, because psychologists not only have the do no harm model, in our ethics code we actually have to be beneficial. We can't just take people's money and see them week after week after week and have no demonstrable positive effect on their life. That's unethical. So you should be getting better over time. It's no guarantee that you're going to get better quickly, but we do have evidence that if you take this route, the gains are more durable. You're less likely to have relapse and more likely to be able to pull yourself out of declines in mental health quicker on your own. And then be a thoughtful, careful consumer. If it doesn't work, don't give up on it, right? Use my plumbing analogy, right? If you got a bad plumber, you don't say, man, plumbing's bullshit, man. Plumber's a bunch of, you get another plumber, right? If you get a bad therapy experience, don't go, oh, therapy's a bunch of bullshit, man. Get another therapist and try it again. And if that one doesn't work, do what happens when you get the next plumber that doesn't work. You get another one, right? If you have serious issues in your life, this can be really helpful, but you have to engage it. And you're up against barriers. Paying for it ain't easy. And some people, man, I don't have time to go to these things, these therapy appointments, or I don't have money for them, but then they might be on medication for years and years and years that they may not need to be on, but they're paying for. If they had put in the time on the front end, whoever knows how many sessions that might be, it would be varied by the individual. But if you could put in 8 to 10 hours of therapy by going to 8 or 10 sessions, and that could give you a positive outcome for years and years to come, those 8 or 10 hours will be well invested, right? But paying for it counts. Text, y'all. If I can hear you up here, that's way too loud. Text, don't talk. Managed care means that you have to pay through a system. Now we're seeing the Obamacare, which is not actually called that. It's the Affordable Care Act, right? And it's actually a longer name than that. It's a response to the fact that our healthcare system is pretty messed up in a lot of ways. Is it going to fix it? Hell no. Is it going to make us look at it more frequently and try to get better and better? That it will do, or we hope it will do that. It's been changing for years. When managed care came on the scene, it was just as big an uproar back in the 80s. When they talked about managed care, that's not going to allow me my choice of doctors, and it's not going to allow me my choice of types of therapies or treatments or whatever. There were implications to that. There's always going to be implications to that because services cost money. People are providing them, they're getting extensive training to do them, and they have to get a living out of it. Now, some people make a lot of money and some people don't make a lot of money providing health care. There's no simple solution, and don't let people convince you that there is. And you can argue from this side to that side. I don't have the answer, and guess what? Neither does anybody else right now. What we got is a mess, and if people will take the time to realize that instead of yelling at each other and try to fix the mess, we'll be better off as a result. But one thing we definitely know is it impacts your ability to get care. Some people can afford very high quality care, and that's fine, and that's good for them. Other people cannot even access any care in the mental health field because it's not available. Rural mental health care is a problem in our country because people who need access to good quality mental health care oftentimes cannot find it within dozens, if not tens of miles beyond their house. Tens meaning up to 100 miles away, perhaps, that you would have to drive to get an appointment with a psychiatrist or psychologist or a licensed clinical social worker because they're just not available. And if they are available, it doesn't mean you can afford it. So we have all of these options, but who's advertising for these? I am right here in this class to y'all because it's part of this course. But what you see on TV is not that, hey, there's a lot of great talk therapies you can engage in to try to make your life a better thing for yourself. They just don't have those very often. There are pharmaceutical companies that do manufacture drugs that do help with these kinds of issues, but those are the only options that you'll see on TV because they are for-profit businesses, and their goal is quite logically to make money. They invest millions and millions of dollars in research and development, and then they invest millions and millions of dollars in advertisement to help connect their product to a consumer. These products you have to go looking for. And these products, as they said, have no risk of side effects and are shown to have lower incidence of relapse and are on average just as effective as medications. So in that sense, what we would look at from our perspective as psychologists as mental health care options, we would certainly include medications in those options. We wouldn't throw them out, but we would also include augmentation of those medications at a minimum with some kind of talk therapy, which put together, research shows gives you the best possible outcome, at least with issues of depression. Those are just the kinds of professionals you might see: clinical psychologists, psychiatrists, counseling psychologists, school psychologists, social workers, psychiatric nurse, occupational therapist, pastoral counselor. Some preachers, some pastors actually get professional training. So counseling is kind of a part of being a pastor, of being a leader of a church. People who have issues come there and they seek guidance. And they want it in the context of religion or spirituality, which is perfectly legitimate. But there's other things that would be helpful to know if you're the provider of any kind of mental health care, and that's what you want to do, is have people who are trained in it. It's not that people can't be helpful if they're untrained. It's just that if you have serious issues, you should see someone with training, and oftentimes you can find them. You can have a PhD or a Doctor of Divinity, but you would also have a training in psychology. And there are several doctoral programs in psychology that have Christian foci here in America. So those are all possibilities, and when you see the amount of people doing this kind of work, it's pretty interesting that nobody on the street seems to be able to differentiate between these types of psychology or mental health care.